Our laboratory and other partnering laboratories continue to perform whole genome sequencing on a percentage of the specimens that test positive among Monterey County residents. And we are now seeing a greater proportion of the sequenced specimens identifying as Omicron, and a decreasing proportion of the sequenced specimens identified as Delta. So as we've seen in other parts of the country and other counties, we too are seeing that more and more of the infections that are occurring here in Monterey County are caused by the Omicron variant rather than the Delta variant. As far as hospitalizations, we know that or the studies show that people infected with Omicron may have a lower risk for serious infection and hospitalizations. However, with the rising number of total cases, the total number of patients hospitalized with COVID is increasing. And so that is a concern of ours. And as public health has always felt is very important that we in public health, our partnering agencies and the public do what we can to try to minimize the spread of COVID-19 so that our hospitals aren't overrun and our hospitals are able to provide the care we need when we need it. As far as testing, there has been an increased demand for COVID testing, and Monterey County has asked the state for increased testing capacity at our LHI sites, which are also known as OptumServe sites. So hopefully the state will be able to respond and increase the access to OptumServe testing locations. We've also requested testing kits from the state, from the county, and we've actually purchased some over-the-counter testing kits from the state to distribute to local agencies who are in need of over-the-counter COVID-19 testing for their clients. Folks in Monterey County can go to our health department website to get information on scheduling a testing appointment. And if you have questions or need of assistance, folks can also call 211. Moving on to isolation and quarantine, the state and CDC have updated isolation and quarantine guidance documents. And at this time, Monterey County residents should follow California Department of Public Health guidance for isolation and quarantine. If there are any businesses or individuals that have questions about isolation and quarantine, they're welcome to call our health department COVID call center at 831-769-8700. Specifically for schools, school staff and students K through 12 should follow the state's general guidance on isolation. And in addition, school staff should follow the state general guidance for quarantine. However, students K through 12 at this time should follow the state guidance specifically for schools, which includes guidance for quarantine. And if parents have questions, if staff have questions about isolation and quarantine in the school setting, then I recommend that they contact the school principal, superintendent, or the county office of education to get specific information as it applies to them and their child at the schools. As far as vaccinations, Pfizer has authorized the primary series. Pfizer is authorized for primary series for ages 5 and up, and individuals that are 16 and older can also receive a Pfizer booster. Moderna is still authorized as a primary series for 18 and up, and a booster at age 18 and up. And the J&J is still authorized for a primary series for those 18 and older, and for boosters for people who are at least 18 years of age. And then finally, as far as prevention, the best way to prevent COVID-19 is to get vaccinated, which includes a booster. Masks continue to be an important tool to protect yourself and to protect others. Be sure that the mask has a good fit. That means it fits tightly around the nose, on both sides of the face and under the chin. And remember that 2 layers in the mask provide better protection and reducing the risk of exposure to COVID-19. And please remember to wear face coverings when you're in public indoor settings, regardless of vaccination status. And that is my update today, ma'am.
Oh, wow.
Thank you very much.
Okay,
Thank you very much, Dr. Moreno. David Aguilar, if you could mute your mic, I'll thank you. Thank you so much. Okay, so we've got some questions who are questions in chat. I'll go ahead, Dr. Moreno, and get started. Dr. Moreno, are most of the cases in the current surge due to the Omicron or Delta variant?
So that's a very good question. So the most recent sequencing shows that most of the cases here in Monterey County are due to the Omicron variant.
Thank you. Next question. Does the county data on hospitalizations include people who are hospitalized with COVID and those who are hospitalized for COVID? Are there plans to separate that data?
Our data shows individuals that are identified, who are hospitalized, who are identified as having COVID. We do attempt to discern those who are admitted because of COVID and those that are who are admitted for other reasons who happen to have COVID. And that's something that we, on a periodic basis, review with the state to try to provide the best numbers that we can. So that is periodically reviewed and updated. And that's how we're handling the cases at this time.
Okay. Another question. Is this surge more or less concerning than the surge in winter 2021?
I think as long as we're in this pandemic, we should all be very concerned about the risk of exposure to COVID-19, regardless of which variant is circulating. So it's still very important to follow many of the same precautionary measures that we've been following for quite some time now, which is primarily getting vaccinated and then wearing face coverings, and then trying to spend as much time, if we spend time with other people, if we can, spend it outdoors, and follow any state guidance that applies to you, your organization.
Thank you. Another question, does Monterey County intend on issuing an order limiting spectators at high school sporting events due to the presence of the Omicron variant?
So at this time, Monterey County is still following state guidance that includes both specific guidance for schools as well as guidance for mega events, which has been released and updated by the California Department of Public Health.
Thank you. And just a follow-up question where you were talking about testing kits. Is there a number on the amount of test kits the county has ordered from the state?
I don't have that number, but that number is changing constantly as more allocations are being made from the federal government to the state and from the state to the local counties and to local organizations such as local schools who have been offered testing kits as well.
Yeah. And so the reporter is asking any ballpark figure. Are we talking a few hundred, 1,000? What do we need? Right.
No, again, I don't have that number. It's a constantly changing number, and I don't have the full number because there are a lot of kits that are being offered to other organizations in Monterey County that I'm unaware of.
Okay. All right. Thank you. So let's move on to some other questions. Dr. Moreno, would you support further restrictions such as the closing of restaurants and bars to help prevent the spread of Omicron?
Thank you, Mia. At this time, we continue to follow the California Department of Public Health guidance, which is the general guidance for gatherings, face coverings, and recommendations for testing. And again, there's guidance specific to businesses that come out of Cal OSHA that businesses should be aware of, and that businesses should check the Cal OSHA website periodically for updates on regulations that they are required to follow to protect the safety of their employees and their customers.
That's all the questions that I have in chat right now. Are there any final questions for Dr. Moreno before we let him go? Okay, here's another one. Hold on, Dr. Moreno. How much of a risk does Omicron present in schools? Dr. Moreno? Oh, Looks like we have lost Dr. Moreno. I'm sorry to say. I see additional questions here in the chat. If he doesn't pop back up, I'm going to send these on to him and get the responses to you this afternoon. Sorry about that, those who asked. So let's move on to our next topic. We're very pleased to have Deb McElhaney, who's with our Department of Social Services, joining us today. The increasing case rates have been in the news, and a lot of people may now be wondering if they test positive or have been exposed, what is the best way to safely isolate? Monterey County does have a referral system for isolation housing and an alternative housing program, but there are many options for people to safely isolate. And Deb is here to talk about how to safely isolate and then what is happening with our alternative housing sites. Good afternoon, Deb.
Hi, Maya. Thanks for having me on. Would you mind if I shared my screen really quick?
Please do.
So I put together, can you see the document?
I can.
I put together just a little quick list. And I think one of the things that I want to share with everyone, so we have to help the public figure out, can I or can I not safely isolate? And my staff and I do this all day long. And of course, it's increased now because our numbers are increasing. And we started doing this back in June of 2020, if you can believe that, just trying to help the community understand what safe isolation is, safe home isolation, and what is not safe home isolation. And if you cannot do that, then there are some options for you, and we'll get into that in a little bit. So one of the main things that we want to stress with people who are home isolating is monitor your symptoms. We all know that if you do have the respiratory form of COVID, that, that's the most serious kind. And we know that it affects everyone differently. But what we encourage folks to do is get what's called the oximeter. You can buy them at you can buy them on Amazon, you can buy them at some grocery stores, and you can buy them at all the pharmacies. And there are YouTube videos to help you learn how to use them. To me, they're as critical in the home as a thermometer is, and they're easily accessed. Learn how to do it. It could potentially save your life. As we know that if you have the respiratory form of COVID, you are potentially at risk. If you experience any shortness of breath, get yourself to the ER. So one of the main things that people need to do to safely isolate at home is stay in a separate room from any other household members. I know at times it's impossible to do that, and that's where we can come in. So if you do not have a place to safely isolate yourself within your home, apartment, or whatever it may be, and you do not have another place to go, you can hit other people up who potentially have a spare room, another house in the back of their main home, or wherever it may be, to where you can safely isolate yourself. If you cannot do that and you cannot afford a motel, then that's where we can come in and we can help you. There's lots of different ways to get to our program, and I'll get to that at the end. Also, within your home, if you are home isolating, it's very important that not only do you have your own separate room, but you have your own separate bathroom. If you can possibly do that, if there's 2 bathrooms in the home, make one just for that person or persons who are infected, and keep those 2 bathrooms separate. But not everyone's lucky enough to have multiple bathrooms within their home. So there is ways that you can do this, and you just have to make sure that, sorry, my phones are constantly going off. Make sure that you are able to disinfect that bathroom thoroughly, and that means the air and the surfaces after each use. And then also make sure when, say somebody has to cross a hallway, and then common hallway, make sure no one's around, wear that tight-fitting, well-fitting mask like Dr. Moreno referred to earlier, and don't cough, don't talk, just go across, access the room, and then when you come back, the exact same thing when you come back to your isolating room. Do not go in any of the common areas within your home that have non-infected people. Also, meals are very important. People need to eat while they're isolating. So do not prepare your meals, even if it's, for a short time. Have someone do that for you. If you don't have access to meals, call 211. They'll be able to help you out and provide you with some resources. And then, both the infected and non-infected areas, open up the ventilation in in the home if you can. Also, don't forget your pets. Don't have interactions with your pets while you're infected. And absolutely do not share anything in common that you have. So let's get to what you can do if you do not have access to safe home isolation. You could call our number at 831-356-3133 or 3136. You can get referrals to our program from clinics. All the clinics have access to be able to do a referral to our Monterey County Alternate Housing Site program. The hospitals all have access to be able to refer community members to our program also. So I think that's about it, unless there's some questions.
Right. That was a really good, thorough walkthrough of this. Thank you very much, Deb. If you could stop sharing your screen right now. I've got some questions that have come in, and we'll go ahead and get started with those.
It won't let me stop sharing. There we go. There.
You're commandeering. You're commandeering. Okay, so so here's a couple questions for you. You mentioned something early on in your comments, Florona. Was that what you were saying? People were wondering about that.
Oh, what did you say, Florona?
Is it Flurona? What do you describe something you should have, everybody should have in their home?
Oh, no, I apologize. An oximeter. You know the little thing that they put on your finger when you go to the doctor's office? They
Right.
just the little box, the electronic box, and it measures your heart rate and also your oxygen level in your blood. So they're just little oximeters. If I would have thought ahead, I would have got one for you, but I can still do that while we're talking. But they're called an oximeter, Oximeter.
Yeah, there was a question about Flurona maybe, and did you mention some flu? Did you mention anything that sounded like that?
No.
Just making sure. Okay, I'll get back to the person who asked the question and wonder what they were.
It's probably unclear articulation.
Well, we won't go into that. I've got some other questions here related to hospitals and children COVID cases, and I don't have anyone's able to answer those. There are some representatives from the hospital on the call, but I'm not sure they're able to answer it either. I'm going to refer these questions over to them, just for the person who asked. Yeah. So here's a question for you then, Deb. What is the capacity for the alternative housing sites, and how full are they right now?
Well, we have right now at San Lorenzo Park 19 trailers that are available. Well, actually, really only 18 are available. We have one that's down. We have currently 16 trailers full, and we have more people coming in today. So we will most likely be full by the end of the day at San Lorenzo Park, and then we will have to open our North County site.
And when you say North County site, can you tell us what that means? What is our North County site?
It would be hotels.
And so, and again, what's really important for people to know is that this is a referral program. And could you reinforce again the fact that a referral is needed, that this program is there to help people, but the referral process is critical?
The majority of our questions come in about how do I get a referral. So if somebody is at any of the Natividad clinics, the Clínica de Salud, the Monterey County Health Department, a case investigator calls, you need alternate housing site services, they can all do referrals for you within our system. And then my team, once they get the referral, my team picks them up and starts processing and working with the individual that they did the referral on.
So say there's somebody who finds themselves with a positive test and finds themselves in a situation where they wonder if they can safely isolate. They look around and say, I don't have another, I'm sharing a bathroom. They look at their environment and wonder how they're going to get better. Should they call this referral number or 211 and get in, talk to you?
There's no wrong door. So you can call the COVID call center. They can assist you. The health department can assist you. We can assist you. There's a lot of, I would say, service providers who have really learned what safe home isolation means. So there's really no wrong way to access the information.
Okay. Thank you. And then Flu-Rona is COVID and coronavirus and flu combination. So that's the mystery word. And the question about that, we're going to refer to Dr. Moreno. So we all got upped on our abbreviations today.
All right.
They stumped us. So that is all the questions that I have for you, Deb. Thanks very much for taking the time. I know you're busy down there at the site, and thanks very much for sharing this information with us.
My pleasure. Everyone take care.
All right. And then for a last, but definitely not least, we're very pleased to have Carl Sidoric from the Monterey Salinas Transit on with us. Last year in December, the MST announced its zero emission bus plan. And it was right before Christmas and everybody's going out Christmas shopping, but we wanted to have him on to talk more about what does it take to work that zero emission bus plan, and where are we now and where are we going? Good afternoon, Carl. Thanks very much for joining us.
Oh, you're welcome. Thank you for having me, and thank you for the interest. And glad to be here. I'm real happy to be talking about something other than COVID for a change. If there's a question about COVID, I'd be happy to answer it though. But basically, MST has been, we're going into our 50th year of operation this coming year. And in all of that time, we've been experimenting with a wide variety of alternatives to fossil fuel from, the early 80s lead batteries to in the 90s compressed natural gas, and to the early aughts, we did electric hybrid and biodiesel. 2010 timeframe, we had the first wireless electric charged bus in the country with our trolley. And more recently, we've purchased 4 zero emission buses that are operating throughout our service areas. So there was a lot of trial and error just getting used to the zero emission battery electric buses. In the interim, a statewide rule, the Innovative Clean Transit Rule, went into effect that will require all transit operators to be 100% zero emission fleets by 2040. And after 2026, we will not be able to purchase anything other than a zero emission, either battery electric or hydrogen fuel cell powered vehicle. So we adopted a plan that will get us there in compliance, either meet or exceed the goals set by the state. We've already have a head start with the 5 electric buses that we have within our fleet. We have plans to purchase more as these regulations come into effect. But we have identified between a $70 to $100 million unfunded gap in order to afford these vehicles. What we've learned is that the range of the battery electric vehicles is probably not sufficient enough for us to operate throughout our entire, Monterey County is a large county. Plus, we also operate into San Luis Obispo County, down to Paso Robles, into Santa Cruz County. And prior to COVID, we were operating up into Santa Clara County, going into Gilroy, and even to San Jose Airport on a daily basis. At some point, when we restore all of our operations, we may do that again. And the current state of technology, battery electric buses just don't have the range that will provide us the ability to do that. So we're also looking at hydrogen fuel cell technology for those longer distance routes. So we'll be looking at a mixture of battery electric charged buses and hydrogen fuel cell buses for the future. Currently, a battery electric bus, each battery electric bus reduces over 3,000 tons of CO2 and 20 tons of nitrogen oxides, 700 pounds of diesel particulate matter is equivalent to removing 54 cars from the road. So as we continue to grow our fleet of zero emission vehicles, we'll continue to contribute to decreasing the greenhouse gas emissions of transportation in our community. We've also, not required by any sort of mandate, but just because it's the right thing to do, MST stopped using petroleum fossil fuel back last August, and we are now using a what's called renewable diesel. And it's a fuel that looks and acts like diesel fuel, but it's made from natural fats, vegetable oils, and greases, and now powers all of our diesel bus fleet. So that change is decreasing reduction of 20,000 tons fleet-wide of CO2 for the entire fleet. Finally beginning, also starting in December of 2021, we started our South County operations facility in King City. And by dispatching buses that serve the South County communities out of King City, rather than dispatching them out of Salinas or Monterey, we're going to reduce 900 tons of greenhouse gas emissions by just making shorter trips operating out of a more local garage. And then finally, as we look to implement a busway and bus rapid transit project adjacent to Highway 1 between Marina and Sand City, when that becomes operational, we're anticipating another 1,300 ton reduction in greenhouse gas emissions as a result of that project as well. So MST is doing its part to reduce greenhouse gas emissions. Personal transportation is the biggest contributor to greenhouse gas emissions, global warming, and all the impacts that we've been seeing as far as wildfires and flooding and extreme weather. And we are, part of the solution and making very significant investments to do our part to reduce the impacts of transportation on the environment.
Carl, thanks very much for running this down for us. There's a lot at stake here, and there's a lot of work to be done to meet your goal. I noted in the press release that you sent out, you talked about the unfunded, what is needed to fund all this work. How can you look forward between now and 2040 and, fund these projects?
Well, first, we've seen significant increases in federal funding available through the Infrastructure Act that was recently passed in Congress. So that will provide additional funds, but MST will have to compete for that, most of those funds. We'll see some increase in formula money that comes to us, but not nearly enough money to make these types of total investments from federal sources. There are some new state programs funded through cap and trade and the SB1 fees placed on gas and diesel. So that's bringing in, again, some more money. But again, Monterey County is one of only very few counties in the state that has a transportation system or a population the size of ours that does not have a local sales tax source that's dedicated to public transit, ongoing fixed route transit. We do have Measure Q that was passed in 2014, but those funds are restricted to be used for our rides services for persons with disabilities, veterans, seniors, special programs like MST rides, taxi vouchers. We may look to some other local sources in the future to help fund the transition from traditional fuel sources to alternates, zero emission sources.
All right, thank you. I don't have any questions for you. I think you gave a super thorough look at what was happening, and we really look forward to seeing more of these new buses and all of the projects coming to fruition that you described.
Thank you. Look forward to delivering them.
Thanks for joining us, and thanks everyone for being on the media briefing this week. Our next briefing is next week. We'll see you then. Good afternoon, everyone.